As you can see, I'm not Nancy. Nancy has been suffering from one of the things that happens in the Zoomiverse, and that's an internet problem. So we will be carrying on without her, but grateful for her efforts in organizing this roundtable. So we'll wait just a minute or so to get everybody checked in, and we'll go ahead and get started. Good morning, Nakeina.
Good morning.
Did you see Nancy's email?
I just did.
Okay, so I thought we just have the three of us introduce ourselves and then go in the order she told us before, okay?
Okay.
Super. So we'll just give it a minute or two more and we'll be in great shape.
Sounds good. And since this isn't a moderated discussion, should we just start with a little bit of an opening?
Yeah, well, I thought we just, she was saying we'd start with a little bit of an introduction.
Okay.
And then each of us do, she had indicated the three things she wanted us each to do, the things that were on our list. That's okay.
Sounds good.
Good. I don't know, I think all of us have gotten so used to the idea that things happen in the Zoomiverse that
we just figure it out.
I know everybody is waiting for 11:45, but if those of you who've checked into the room wouldn't mind turning on your cameras, we won't mind if you're still nibbling lunch or whatever else you're doing. Be nice to be able to see who's in the room. Looks like it's 11:45. So if it is, what we thought we would do, for those of you who just came in, Nancy, Augustine is not able to be with us. She's having internet problems on the East Coast. And so we'll go ahead with the roundtable as she had planned it. And with a thanks to her, even though she's not here, for organizing us and getting us together. So what we thought we'd do is just start with some brief interviews or introductions of the three panelists. And then Nancy has asked us each to briefly address some subject matter, and then we'll open it up. And since this should be a roundtable discussion, hopefully lots of folks will want to participate. So with that in mind, Aparna, would you like to start it, please?
Sure. Thanks, Phil. And thanks for taking over as moderator at the last minute. We appreciate that. So I am Aparna Soni. I'm an assistant professor of public policy at American University's School of Public Affairs. I'm actually, this is my first NAPA event. I'm in the policy space, so I generally attend more of the public policy conferences, but very happy to be here. And my work focuses on healthcare policy. So my training is in economics. My degree is from Indiana University in economics and public policy, and my work focuses on how state and federal policies can improve individuals' health. broadly speaking. And within that, I've done work on Medicaid expansion, looking at how the Medicaid expansion that happened as part of the Affordable Care Act affects different outcomes like mental health, cancer outcomes, access to care. I'm also interested in the impacts of the COVID-19 pandemic on people's public health and policies. And a recent area of research is policies to affect mass shootings and prevent mass shootings, essentially. So that's been a recent area of research.
A challenging one, to be sure.
Yes.
Nakeina.
Hi, Nakeina Douglas Glenn. I serve as the interim director of the Research Institute for Social Equity, among other hats that I wear at the university, but this one brings me to the conversation today. The Institute was established in 2019, just prior to COVID, and so much of the work that I'm going to be talking to you about today in terms of our Institute is really been in the last 2 years. I also serve on the faculty in the Wilder School of Government and Public Affairs, where the Institute is housed, and direct a leadership institute as well called the Grace Harris Leadership Institute, where we provide leadership development for faculty, staff, and administrators at the university, and we have 2 community programs as well. I look forward to today's conversation.
Thank you. I'm Phil Cooper. I'm in the Department of Public Administration at the Hatfield School of Government at Portland State University. And also active in the Intergovernmental panel at the Academy, and have been participating in the advisory group for the creation of the new Center for Intergovernmental Partnerships, which of course Nancy heads for the Academy. Nancy, when she organized the panel, asked us each to take on a little bit different role. She asked me to start and talk a little bit about obstacles to connecting academic research to practice. She asked Nakeina to talk a little bit about bridging the divide and how to do that better, given her experience in doing exactly that kind of thing. And Aparna to talk a little bit more about her research and the way it relates to these challenges and how she's overcome the obstacles. So with that in mind, this is an interesting challenge because the whole point here is to really come at this with a kind of an intergovernmental approach and to avoid some of the problems that happen when we don't come at the whole discussion of social equity with that kind of an approach. And just to start, let me offer what I think is a reason why we sometimes have problems. I don't know how many people have actually looked at the numbers, but there are actually 90,126 separate units of government in this country. 90,126. Now, of course, of that, 1 is the federal government and 50 are the states, and that tells you where the other 90,000 are. Not only that, of that, we've got 90,000, that's 90,075 local governments. Of that, we have 3,031 counties, 14,495 municipal governments, and an additional 38,542 special districts, not counting independent school districts. Now, the other thing is, if you kind of look at employment, you know, if you ask the average person in this country where people in government are, we all know what the answer would be, right? Washington, D.C., not. As we all know, if you really look at the numbers, what does it tell you? It tells you that 63.3% of all government employees, full and part-time, are local. That's almost 2/3. That about 24%, roughly speaking, are state. And only about 12.7% ballpark are civilian federal government employees. It also tells you a little bit that at the state level, some of these numbers are even higher. Here in Oregon, for example, although we have quite a large number of federal employees, given the size of our state, it's still the case that 74% of all the public service professionals in this state are at local government level. Now, why is that such a big deal? Well, how much of the time do we spend talking about social equity in terms of local communities and local governments as compared to national policy? And the answer is not enough, probably. Okay. Now, we won't even talk about the international situation because we don't have time today, but I don't know if anybody has looked at the population clocks yet. Since we seem to have some people in the United States who think that we're the center of the world, they seem to have forgotten that we represent only 4.2% of the world's population. And so it's important that we kind of take another look at where we are and where we're trying to all do the work that we all hope to do. And more important than that, where people live, where the communities are that we really care about, and where the public service professionals are and community members who are active in governance are. And so if we could keep that in mind, one of the things we might want to do is think about how much our research and our literatures really pay attention to those differences, and how much we get focused on the federal government, how much we get focused on the states, and whether we really are looking at the intergovernmental piece to include nonprofits and, in some cases, for-profits that are a part of our governance communities that we create to address a lot of the issues that we're dealing with. And on top of that, of course, the many informal organizations within our community. And as everyone in this meeting knows, when it comes to issues like social equity concerns and trying to have a social equity lens on some of what we do, and indeed all of what we do when possible, and we should, the problem there is a lot of people aren't involved in formal organizations and they're not involved in government. We all know that. I'm not so sure our literatures reflect that as much as they might. So what are a couple of the obstacles? Well, some of these are pretty well known. And to the people in this audience, in this group, they're old news probably, but just to rehearse a couple of them. First of all, some dangerous assumptions. First dangerous assumption, false dichotomy, theory versus practice. When did that start? I don't know when we started the idea that theory has to be some way or another disconnected from practice. We could all talk about the philosophy of social science in the post-World War II period and the whole rise of logical positivism and all the rest. But the plain fact is, in the world in which we live and work and hopefully try to achieve something more like social justice, something more like social equity, surely we're not going to try to argue that you could have some kind of rock solid disconnect between theory and practice. At least I hope not. A second one is, and again, this relates to our modern notions of what science and social science are, the assumption that we need large databases of sophisticated quantitative data, along with sophisticated tools, software tools, to be able to do the research. Now, it's true that some of the areas we want to do research in require that. If we want to talk about, for example, issues of discrimination in employment, if we want to talk about inequities in pay, if we want to talk about voter problems and apportionment, sure, there we need big data, no question about it. But, you know, it's interesting that, in fact, an awful lot of the important data in this field comes along in things like case studies or comparative case studies or whatever. So, yes, it's a challenge to get good data if we want big, sophisticated databases that truly are actually representative and really do have data that doesn't carry the kinds of biases that we all know about that so often are a problem. But we don't all have to do that. I would just point, for example, the fascinating study. I don't know how many of you saw and it was widely publicized in Bloomberg News, the story about the Detroit tree planting situation. Anybody see that? I don't know if anybody saw that. Fascinating story. A group, an NGO, a nonprofit organization, working with the city of Detroit, trying to help Detroit recover from some really complicated challenges. And we all know that the city and the whole metro of Detroit has been going through lots and lots of those for a long time, by planting trees in the city, only to find out that a very significant number of the 7,500 people who were approached and offered free trees to be planted by this nonprofit organization, not at their expense, refused. Well, why? Well, it turns out in the end, a very small scale study done by some scholars, one out of the University of Vermont, for example, that was doing originally dissertation work, but then ended up publishing a really good piece on it, found that nobody had ever really talked to the people in the community about why they were concerned about trees. And it had to do with not with the trees, but some problems with the city government over time. It didn't have to do with trees. Not to mention the fact that the organization that was going to do the tree planting was almost all white. And they had a total of one community outreach person. Well, it shouldn't come as a surprise. That was a quite small study. It didn't involve big database. It was one-on-one interviews, incredibly revealing. Just one example of the many that we know about. That it's important. Not only that, one of the interesting things, if we think about the scope of social equity to include, as we so often do not, civil rights, Okay, don't ask me why we haven't traditionally. When we talk about diversity, equity, and inclusion, and now we add the word accessibility in some contexts, it should be there, of course. But too often, we really don't look at civil rights, basic civil rights issues, in addition to diversity, equity, and inclusion issues and accessibility issues. So if we add that in there, there's lots of stuff that's done without big databases that has produced an awful lot of important knowledge in a lot of areas. So it all depends on the research question. What are the research questions we can get at? One thing that sometimes happens is the argument is, well, wait a minute, the things that practitioners want to know about or people in the community want to know about are not good research questions. That's one of the issues that Nancy noted that has been raised by some people. Well, the problem there is, of course, whether we're talking about policy issues, whether we're talking about legal issues, or whether we're talking about implementation issues, oftentimes when people start talking about a problem statement, that's not a nice, clear issue statement. We have to get from where the problem statement is to a researchable research question, right? It's the same thing when working with, we're trying to develop a new public policy or dealing with a legal case, same kind of thing. So it's not just that it's not always the case that the questions are so disconnected they won't work with each other. It's often that we have to start with the problem statement and go to a question that is researchable. And sometimes we don't do that. Now, another one is in the academic world, what do? We carve up the world into our little fields and subfields and our publishing preferences by journal. And we know so often that each of those has a very particular slice of the knowledge world and how we're supposed to go at contributing to those publications and all the rest of it. Strange thing, of course, as we all know, that's not the way the world works. The world isn't divided up by academic subfields and journals. And so sometimes it is a challenge to try to figure out, okay, especially if we're helping a new scholar who's coming into the field and they're worried about promotion and tenure, they're worried about being able to get published in good places. But okay, great, but we also want usable knowledge and we want engagement. So how do we help get beyond that? That is a challenge that we have to work at. Of course, related to that is another one, which is we're never ready to talk about our research until it's been published in a peer-reviewed journal. Well, why? I mean, think about that for a second. Is that really the case? Do we have to wait until it's published in a peer-reviewed journal? You know, if we think about that for a second, think about what that means. Don't know how long it takes you to draft an article, but it takes a lot of people a fair period of time. Certainly me, it does. And then what about getting it reviewed? Well, that can take for a while. We all know that. And then, of course, I'm sure all of you get accepted first time out, but some of us have to revise and resubmit. Right? So how long does that take? Because it has to go back out to reviewers again, right? And then once it's accepted, what's the delay time between that acceptance and publication? Meantime, where's the knowledge going to the community? Or is it going to the community? Is there still a connection between the people whose communities were the subject of the research and the information that's supposed to be helping them or benefiting them or informing all of us about them or whatever it is? That can be 2 years or more, right? It's a long time. So these are some of the barriers that are frequently raised along the way. Just one or two more points. And that is, part of the problem is doing the research itself, of course, and these issues about accessibility of data and all the rest are certainly tied up with things like credibility and trust. We've already talked about that in some of the earlier sessions today, as we all know. Let's face it, in certain communities in this country and in other countries, if somebody who looks like me, dressed like me, shows up and starts asking questions, I may not be the person who would be greeted most as if I'm there to help or there to assist or be informed or learn from them. Sometimes people might make the assumption, given history, that somebody like me may be more of a problem than somebody you want to talk to. So yeah, credibility. You know, what is this, given our experience in the past, how credible are we who are trying to do research when we're going to the field? Some folks, great. Other folks, not so much. Depends on the community, depends on the experience, depends on what we're trying to do. But yeah, those problems are there, certainly. Of course, the other question of credibility is, what have we done in the past when we were doing research? Did we ever share the research when it came out with the community? Did we ever make sure it was published, maybe if it was done in a community with multi-language needs? Did we ever make sure it was available in anything other than an academic journal in English? Maybe not. Did it take us forever to get back to them? All these go to the credibility issue. The other thing is, was it community-based? I don't know how many folks have really been involved. We here at Portland State pride ourselves on community engaged scholarship. It's one of the hallmarks of our university. We care a lot about it, but there's so many places around the country doing it. The experiment with chamacos at the University of California, Berkeley, in the Salinas Valley, working with farm worker families over generations now. The example of MCHEC in Detroit from the University of Michigan, working with folks in the community over extended years in Detroit on a number of issues that are important to the community. All of these were important. Sometimes doing this kind of work, of course, requires cultural interpretation. Dr. Claudia Vargas has written a good bit on this. I didn't say linguistic interpretation, I said cultural interpretation, right? And because we even have this problem within the academy, right? We have trouble communicating across subfields or fields, let alone communicating with folks who aren't in the academy or who are practitioners or who are in different kinds of agencies or whatever. I taught for many years in med schools. And a lot of the advanced practitioners would say, you guys in government can't talk without using acronyms and abbreviations. And I said, that's all right. You clinicians can't have a standard conversation past 10 minutes using normal language. So we're all in this together. We all have our jargon. We all have our lenses. We all have our perspectives. And so that cultural interpretation, not just linguistic, but cultural, is also important to be able to do community engaged research. Research that people in the community think is valuable to them. Last point on this, and that is the need to prepare scholars going forward, or our master's level students who are going into the field as practitioners. If we teach them in the classroom as if our scholarship and our research are totally separated from the life of practice they live and that their communities live on a day-to-day basis, it won't be surprised that we're going to perpetuate the problem that we have of theory and practice divide over a long period of time. So changing that's important. And by the way, I can't finish without saying, again, putting in a word for some basic instruction in addition to diversity, equity, inclusion, and accessibility, to some basic civil rights education. I've been teaching that field for many years in our master's program and trying to do it. I threw away the law books a long time ago, and I do it with a book that I did on civil rights and public service. But it's so important just to understand the basics because so many of our students don't. And when I say basics, I ask the students in our classes all the time, how many of you know who Charles Hamilton Houston was? I almost never get any recognition, even though Charles Hamilton Houston was probably one of the 5 most important civil rights leaders in the 20th century, about whom nobody knows much of anything unless you happen to be in certain fields. And yet, of course, it was Charles Hamilton Houston who was so important in the development of the civil rights movement in the legal side, working with the NAACP and then later bringing along an entire cadre of lawyers that he had trained in law school to be the leaders of tomorrow, people like Thurgood Marshall, of course, Spotswood Robinson, a number of others as well. So some basic knowledge for all of our students going to the field that ties theory and practice together. So thanks very much. With that, I'll turn to Nakeina.
Great. Thank you, Phillip, for that wonderful presentation. As I said, I'm the director of the Research Institute for Social Equity at the Wilder School of Government and Public Affairs in Richmond, Virginia. And it's important to know where the Institute is located because we are in the School of Government and Public Affairs, which is in the capital of the state. And so much of what we do is bridging that academic work that we do within the university to the practice that our brothers and sisters, our colleagues downtown do in their everyday work. And so the Institute was established in about 2019, and so I'm the interim director there. And right out the gate, we were faced with COVID in March of 2020. And so this partnership, I'm going to give you an example of how we were able to bridge the academic and practitioner partnership with our state colleagues. So much of the work that we do through the Wilder School, we have a cadre of centers within the school who all support our work with our state and local agencies. And so we have the Grace Harris Leadership Institute, which provides training and development, as well as our performance management group, which also provides training and development for state employees, as well at the management and senior leader level. We also have our survey evaluation research lab, which provides a number of research and evaluation supports to state agencies and local agencies, and our CURA, our Center for Urban Regional Analysis, which uses a lot of GIS mapping and economic analysis for our state and local government agencies. And so we have a history and a legacy of really providing this work and bridging that gap between what we do in the academy and what needs to be done in our state and local government. The Research Institute for Social Equity obviously focuses on equity. So it's an organizing body for the equity work that we've been doing here in the Wilder School. As you know, we are home to of great colleagues, Blue Wooldridge and Susan Gooden, who have also been pioneers in this work around equity. And so we established the center here to really operationalize that work. Recently, we were called in, probably I believe in March 2020, to focus on equity around the COVID vaccination, or it was actually later than that, later in the year, around equity in the COVID vaccination by our Virginia Department of Emergency Management, who had sort of central control of thinking about how vaccinations would be distributed and then executing on that distribution. And one of the things that they noted, or we noted very early on, very publicly in a news release, was that equity measures weren't being included in their distribution plans. And so in the state of Virginia, they had initially decided, just as the federal government did, that we were going to distribute all vaccinations related to age. And so we know, particularly in the cities like Richmond, the individuals don't live as long. So people of color, for example, in the city of Richmond, there's about a 10-year age gap in life expectancy between our white populations and our African-American populations. Our community in Richmond is very dense, and just a mile, sort of, I guess, north of Richmond, you were likely to live 10 years more if you were white and lived in the suburbs of the community. So we knew right off the bat that an age scale was not going to work for our communities here in the state of Virginia. And we also posed this information or presented this information to state agencies, and they said, well, come work with us. And so we did. And so, you know, what do they say? That, you know, you sort of speak up and then you get all of the work. And so we were very pleased to participate in this process. And so some of the things that we learned throughout that process, and you can read a little bit more about the partnerships. I'll drop another link in the chat for you there. The National Governors Association profiled the work of the Equity Leadership Task Force, one of the partners that brought us in, and focused on what the partnership was able to do in terms of distributing vaccines across the state of Virginia. Our role in the partnership in particular was really to integrate and infuse the equity narrative into the conversation. And so we focused on this by developing a relative rate. Dr. Jade Berry, I believe she was on the call here earlier, she was one of the consultants on the project and helped us to develop a relative rate of vaccination so that we could decrease the gap between white individuals who were contracting the virus and dying of the virus, and also getting vaccinated, and saying that we needed to have a relative rate for all populations within the state. Until we could achieve or get closer to 1, we knew we did not have equity there. And so the agencies, we partnered with the Virginia Department of Health, Virginia Department of Emergency Management, all within the task force here in the state to focus on this conversation of equity. They were very welcoming to this conversation. I think one of the things that we talk about, we have a forthcoming chapter in a book, an edited volume that the Wilder School is putting out, and it focuses on this partnership. One of the things that we found here that was valuable to the partnership was really trust. These agencies knew that the Wilder School had a good reputation for doing excellent work as it relates to analysis and evaluation, and also equity. So there was ultimately a level of trust that was already established, level of trust that was already known there. The other thing here was that there was a shared mission and goal. Ultimately, our goal was to get as many vaccinations into the arms of Virginians as we could. And so because, you know, our goal was related to equity, everyone had their own goal. Virginia Department of Emergency Management's goal was really to prevent sort of mass casualties related to COVID. And so we all had distinct missions, but the ultimate goal in the end was the same. One of the things that we were fortunate enough to also have was an organizing body within the state of Virginia. We had a Chief Diversity and Equity and Inclusion Officer, the inaugural DEI officer. And so her office was able to convene all of the secretariats of the state, as well as the institutions, the additional partners. There were nonprofit partners, the academic, we were that sole academic or the main academic partner in this process to work on this. And so her office was able to be the organizing body to bring us all together in this particular situation. What we found here in thinking about our inputs really was that all of the agencies, so our state agencies many times are burdened with bureaucracy, processes, chains of command that they have to follow in terms of getting approval, in terms of communication, their daily operations and funding. As universities, particularly as research centers that we are, and we are service centers, we weren't as restricted by the bureaucracy, even though we're a state institution. So that allowed us some of the flexibility to be able to maneuver in and out of conversations and needs of the partnership with a little bit more ease than our state institutions were able to do. As it came to subject matter expertise and needing those subject matter experts on the team, we were able to quickly contract out additional subject matters and matter experts, and also to get additional hands on deck to be able to support the work that we were doing with our state agencies. So we were nimble and flexible. And sometimes we don't think about academic institutions being nimble and flexible, but we were a lot more nimble and flexible than our state peers or our state partners were able to be in this particular circumstance. Also, I talked about shared trust, having a shared vision as well. We could help the partners really get it done and get it done equitably. And so we were able to push back sometimes in conversations where there wasn't an equity focus. Again, the ultimate goal of the state was to get vaccines in arms, but we wanted to be very strategic. And so were we setting up vaccination sites in communities that were most vulnerable? So we deployed a team on the ground in many of our communities because our researchers within the team had direct community connections, more so than some of our state agencies did. And so we could travel out to communities, our most vulnerable communities across the state, and we had legitimacy in those communities. And so we could bring that information back to the broader team to let them know these are the concerns of our stakeholders. So whether the concerns were, we don't trust the government, or we don't trust the vaccine, or we're really hesitant for whatever reasons, we could bring that direct information back to the state agencies in a way that was timely, that could really help to be data that informed decision-making right at that particular moment, as opposed to having to feed through a process to get approvals, IRB, and the things from the state agency side. We did that up front, so we were able to get out into the field very quickly. We also thought about commitment of time and resources. So the partners, we really relied on each other to think about all of the resources and the partners that we had access to. So the state agencies were able to use, for example, the Research Institute for Social Equity, really to leverage additional workforce information and expertise. Again, so we could use contracts to, again, employ subject matter experts in a matter of days or weeks, where it would take a matter of months. And when I say months, 90 to 120 days to get a new employee sort of even through from the interview process to the onboarding process. And we just didn't have that time in a rapidly changing environment of COVID. Again, the relationship building, we were able to deploy members into our most vulnerable communities. So we spent time in the Crater Health District. And so the Crater Health District, when you think about the rankings of cities across the state, we have some of the cities that rank in the lowest tier in terms of their healthy communities. And so we have 133 localities, and the Crater Health District has probably 130 to 135 of those localities that are least healthy. But we had members on our team who understood and knew the communities and were able to embark in those communities and ask the questions that they wanted answers to and be able to funnel that information back. So it was really important. Expertise and credibility. So as I started my opening the conversation, talking about the credibility that the Water School just brings to this space around racial equity, the Virginia Department of Emergency Management, the governor's office through ODEI knew that they could come to us very early on for racial equity because we had built up years of experience and credibility in this space. And so as new issues arose in this space, we were able to gather data, we were able to identify alternatives to plan, and we were really a trusted partner. I mean, it's so interesting. And the governor would do, I believe it was every Tuesday, he would do a briefing to the state of Virginia. It was televised, and our data from the work that we were doing as one of the partners here was supporting that briefing. We were doing polling across the state through our Center for Public Policy. We do a public opinion poll that's now recognized by CNN, I believe, as the last 2 or 3 years. And so we were trying to anticipate the questions that the things that were on the minds of Virginians, and then anticipating the questions that the secretariats would have and funneling that information back in. So we were trying to thinking about students, parents, whether or not they were going to get interested in getting their children vaccinated and getting that polling data out 2 to 3 months in advance of there even being a decision made on or before the vaccine was available. And so that we could make sure that we were timely, but also anticipating the needs of our community. And then again, lastly was just the diversity, making sure that there's diversity among all of the partners, and particularly all of the subject matter experts, because we believe that that added to the richness and the robustness of the partnership and the legitimacy of that. And just lastly, we're excited to report that our efforts collectively as a partnership, we're able to reduce some of the gaps in the uptake of the vaccination, also making sure that services got into the communities that were most vulnerable, and really helping the state think about an equity framework across all of the work that they do. So I will stop there, turn it back over to Phil, and then I can answer any questions that the audience may have later.
Information in the chat, and hope everybody will take a look at that. And let's turn to Aparna.
Thank you, Phil. And I learned so much from listening to both Phil and Nakeina. Thank you so much, as that I'm probably the most junior person here on this panel, and this is really eye-opening for me. So very glad to be part of this. So I think that Phil touched upon a lot of the obstacles that researchers face when we're trying to get our findings out to policymakers, make them useful, which I think is, everyone's intention, but sometimes the incentives for researchers and the needs of policymakers don't exactly align. And that's been the biggest challenge that I've seen and experienced as well. So I come from an economics background, and in economics journals, easily a paper can take 2 years to publish once it's submitted, 1 year at least, and that's assuming that you get an R&R. You end up having to submit to multiple journals. It could take 2, 3, 4 years. And economists, oftentimes we are the emphasis is so much on kind of finding the causal impact, and we don't just care about correlations or descriptive work, which is often very useful for policymakers and very important work. But there's so much emphasis on how do we tease out causality? How do we ensure that this policy is actually causing the impact that we see, and that it's not just a correlation? And getting that right can just take so long. The work can be very, we can really get deep in the weeds of the statistics and these econometric methods that the policymakers, they don't necessarily need that. So I think that there's a little bit of a misalignment of incentives, and that's one of the challenges. The second challenge is that the timeline is just so different. The process of, they say that perfection is the enemy of done. And, policymakers, they need answers now, right? They needed them yesterday, actually. And if we're taking years and years to do this very careful analysis, which is definitely important, but doesn't respond to the needs, these immediate needs that we have, then, what at the end of the day, what is the utility of what we're doing, right? So trying to kind of align these incentives has been a topic of discussion in the economics world and the policy world. And I just want to share a little bit about one initiative that I've participated in called the Societal Experts Action Network. That's an attempt to address this issue. So I'll throw the link in the chat box. But basically, this is an initiative of the National Academies. It came about in the aftermath of the COVID pandemic. So right when COVID sort of hit around March 2020, the National Academies realized that, you know, for something like COVID, we really need answers now. We need rapid and actionable research. And that's, we need to get that information into the hands of decision makers. So that was kind of the goal of Societal Experts Action Network, SEAN for short, is to connect academic and non-academic researchers with decision makers. And the idea was that, you know, to encourage researchers to do work quickly, even though, you know, the answers, there may be limitations in the work that's done naturally if it's being done with limited data and kind of quick methods, but to get that information as quickly as possible into the hands of policymakers. And this this initiative really received very good feedback from both researchers and policymakers. So my team from American University, actually, we did kind of an evaluation of this project. And as part of that, we did a survey of the policymakers who use this information, and they really appreciated the sort of the rapid information that came in, and the fact that not only came in quickly, but the National Academies, they really put a lot of emphasis on providing succinct information, which is another sort of challenge. Oftentimes as researchers, we do a plethora of analyses, and we have just done so much work on this one question that trying to sort of boil it down into a couple of bullet points is challenging, and it can seem almost reductive of the work. But at the end of the day, that's what policymakers often need. So the National Academies did a wonderful job of kind of boiling down the research into actionable points. So they did this in the form of these brief reports, which they called the rapid expert consultation, something like that, as well as webinars in which policymakers could directly connect with researchers and ask follow-up questions. So they have a lot of great information on their website, and the webinars, many of them have been recorded if anyone wants to check them out. So this initiative was really eye-opening. I think that, hopefully we see more of these efforts, ways to connect researchers with policymakers. And another thing that, I've been doing on a personal basis is trying to, when there's an important question that needs to be answered, trying to address that question in two ways. So one is trying to get the sort of a quick answer out there. So doing a short report. Many times journals nowadays are becoming more and more open to the idea of publishing these short reports or letters to the editor, in which we take the data, we do quick analysis in finite time, and we get the most important points out there to people who need that information. And then as sort of a second stab, looking at the same question, but in a more detailed way, with the idea that, we're going to do a careful analysis with all our sensitivity analyses and robustness checks, make sure that we account for any possible threats to causality, with the idea that, we'll publish this in an economics journal, and it'll be useful for future policies, future issues. So that kind of two-pronged approach seems to be working well, and it seems to be gaining popularity. And then in addition to that, and this is something that I think many of us probably do more so than the economists in the room, but ensuring that in addition to the paper, which will be read by people who are most likely others in our field who are familiar with our field and the jargon and all. Also coming up with a policy brief or a brief report that will be aimed at more of a general audience. So that's something that more and more people are encouraging us to do. And I'm noticing that at many schools, especially schools of public administration and policy, there is reward for doing that kind of work. So publishing these brief reports and encouraging junior faculty to do that can be really useful. A lot of journals are developing blogs as sort of a separate, they'll have their academic journal, and then they'll have their blog in which they might have these short summaries of the papers that have been published in a way that's accessible for the general public. So those are a couple of things that I think that I've seen work both at a personal level and kind of a broader level. I'll turn it back to Phil.
Thank you. Yeah, those are a lot of good ideas, and particularly your points about policy briefs and the like, and the use of websites, really excellent. And of course, one of the things that NAPA does with Management Matters is to try to disseminate some of those kinds of things, and that's very helpful too. So yeah, a lot of good suggestions and a lot of challenges, though. You're right. We all know about the business of trying to help people deal with that need to get into those kinds of journals. And indeed, there are some fields, and having sat on a lot of promotion and tenure committees, I know that economics is one of them, that rates the journals very carefully and then even rates articles within journals at some institutions. So it's a challenge. Well, thanks, everybody. Thanks, everybody. We have a little time available here. So hopefully, after our two colleagues have shared a lot of great information with all the rest of us, we can open it up for discussion, questions, and comments. Anyone want to jump in there? I would just ask one question just to get us started, perhaps. Nakeina, in terms of the demand for the information is clear, but was there a steady funding source or different funding sources, or how do you support this variety of different kinds of work you're doing?
Great, thank you. Great question. And so many of our centers have sort of a foundational budget that they're starting with, and that generally goes to support an E&G budget that may support some part of staff time and some part of their operations. Much of the work that we do is a fee-for-service work, and so the state agency is paying the fee. There's hourly rates that are done by some sophisticated calculations that our fiscal managers do in terms of what's the value of the time for either the faculty member or the consultant. We also hire students on our projects as well, and so we have as I said, a robust fiscal team that can help us sort of figure out all the finances based within the budget. In both of these cases, so in this, and we also did, we talked about our language access project that we did after we finished our COVID work. They were sort of a set amount of resources, a finite amount of dollars that we had to work within to get the work done, and also a particular time frame. So we did a 1-year contract with the Virginia Department of Emergency Management for the work related to COVID, and then there were billable hours attributed to that. Again, so we could work sort of as long or as late as we needed to within the confines of that contract without having to be bound by sort of traditional rules of employment, traditional rules of sort of contracting that you might find with a traditional 40-hour-a-week employee within the state agencies.
That's a really complicated process, but I'm not surprised, given the variety of things you're doing.
Yeah, and many of the things that we would do, so we could do their contracts or service agreements, service contracts. We've got sort of a very well-oiled machine that we can get those out of the door quickly. And for instances such as this, where the demand is very quick and the turnaround is very quick, where you have our faculty, we're then sort of writing the service agreements, talking about, what research we're going to do, what contributions that we're going to make to this process, and then what the expectations of the client are. That's one of the things that I always encourage faculty or all of our projects to do, is not just sort of what we're going to give to the client, but then what are the expectations for the client to show up, to provide available data, to provide individuals to be able to answer the questions that we need asked that perhaps we don't have access to. And sometimes that can be a little bit more difficult than not, particularly as it relates to things that are crossing IT jurisdictions. It was sometimes difficult to get, we work very closely on Google, and our state is working in Teams. And so how do we translate and get permissions to access all of that data? Or they're working with another contractor who has sort of a clause in there that they can't share certain data. And so trying to maneuver those kinds of, I wouldn't call them challenges because we were able to get over them, but those hurdles becomes the interesting parts of the partnerships.
Yeah, it is clear that you've got a well-oiled machine there. Aparna, I was just curious. You focused on really important things about the expectations that people are dealing with, especially for younger academics in the field as they're getting rolling. And I guess I am curious because I have this sense that we're not doing a very good job sometimes in some of our graduate programs. I'm sure that where you are, it's great, but I'm not sure it is everywhere. How do you think we're doing in terms of encouraging folks as they are getting prepared to go into the field as academics, as researchers, whether it's in an academic setting or elsewhere, to do the kind of applied work or at least cross the boundary so they're not just doing academically oriented publication type work? How are we doing?
Yeah. I think that's a great question. I feel it varies a lot department by department. So when I was in grad school, I was at Indiana University, I was in the business school, and I felt that there was a lot of support for me when I expressed interest in developing these skills. For example, after we had one publication on the effects of Medicaid expansion on cancer diagnosis, and we found that it increased early detection of cancer. So I felt that this was a topic that there would be a lot of broader interest in addition to just the health economics community. So I expressed some interest to my mentors in writing a press release. And I found support right away. They connected me with the right people. The PR team even trained me on how to answer reporters' questions. And as a graduate student, that was just what I needed. And I was able to kind of speak with the media for the first time in my life. And it felt very rewarding to see the work publicized in that way. But I know that if I hadn't taken that step myself, I don't think that it's something that was built in as part of the curriculum. So I think that, from speaking with my friends, my colleagues, it is like that in a lot of graduate programs where if a student expresses interest or if a mentor encourages them, then they can find ways to make that training happen. But by default, it's not necessarily part of the program. So I think that, maybe making it part of the core program for PhD students once they get their hands wet in the research areas, how to disseminate these findings and how to communicate with people outside of academia. That could be a consideration. At American University as a junior faculty, I find a lot of support as well. And, particularly being in a school of public affairs, I think that there's the leadership is more cognizant of these things. So there is a great infrastructure available for faculty who are interested in developing their skills and interacting with the media. I just think that there's still a lot of initiative that the student or the junior faculty would have to take. So maybe just kind of making it more mainstream would be a step in the right direction.
Nakeina, I'm just curious, did you want to comment on that? You deal with an awful lot of researchers and a lot of practitioners.
No, I think it was very important for us to get students engaged in our research. As I said, a new institute. So we have right now one graduate research assistant that we are supporting both in terms of, I think the finances are really important. Many universities are struggling with how do we support financially the students to make your university attractive to the students. And so we do have this year, we're very small staff too. So I should say that when I say we're supporting 1 to 2 financially this year, it's because our staff is only about 6 people. So we're very small, but we're a mighty team. But it's really important for us as we think about equity. We want want to think about equity as it relates to our students. Building a pipeline is really important in this work as well. You don't have a lot of researchers who are centering equity at the forefront. Well, I'll say prior to the triple pandemic, as the Wilder School calls it, prior to this time, you didn't have a lot of researchers who were really centering and advancing equity at the forefront of their work. I think now everyone believes that they're an equity scholar in some way or another after George Floyd and the COVID pandemic. And so it was really important for us to begin to build a pipeline of students who could advance into this work. And so supporting them at the master's level and also supporting them at the graduate level with not just the research opportunities, but the funding behind that, providing opportunities for professional development as well as providing the financial support as well. And so just as Aparna said, I think it's really important, and that's a value for us in the Wilder School, is to support our students who are doing the work that fits with our mission so that we can produce scholars in this space.
Any other questions? I've got another one, but any other questions from anybody in the group here? Okay, my question, and we're coming down to pretty close to time, but we still have a little bit of time, and that is, you've talked a lot about getting the information from the research that you do out to policymakers, out to the media, that sort of thing. I'm just curious, because I think this varies pretty dramatically around the country and in other countries as well. What you're thinking of how well we're doing at getting information from the research back into the communities where the research is done or where that knowledge is needed. How do you think we're doing there, Aparna?
Yeah, that's a good question. I think, you know, from my point of view, I think that is an area where we need even more progress than, I think that in many departments, there is a lot of emphasis on getting our research out to policymakers in the form of policy briefs, or out to the mainstream community in the form of, you know, doing interviews with media. But you know, not everyone reads the news, and how do we actually ensure that our findings are having an impact on the communities in which we live in, or in the communities that we study? You know, I think that in my field of health economics, that's an area where we definitely need progress. I have seen economists successfully partner with, say, those who are in public health, or those who are in other fields that do work more closely with community organization, or in these grassroots organizations. And I think that that's been a great approach. There are some, you know, I've been noticing more and more funders are asking, you know, to include this component. And that's something that they consider when they're making their funding decisions, which I think is great. It's encouraging us to go in the right direction. But yeah, more work needs to be done.
Yeah,
one of the things, oh, go ahead, Phil.
Go ahead, Nakeina.
I was just going to say, one of the things you just reminded me that we did, and so we did a number of interviews in what we call sort of Southwest Virginia with vaccine hesitant. And so after our interviews, and we did a number of those interviews as well in Northern Virginia, so sort of the DC metro area, with individuals for whom English was not their first language. So in both of these cases, we created then presentations for the community specifically to present back to them the results of the interviews and the conversations that we had had through interviews or focus groups for them, so that they could hear the data that we were also sharing with state leaders and the policymakers as well. And so for us, we believe that the data belonged to the community. So we had a responsibility really to share it back with them in a way that was meaningful for them. And so we did it because all of this was we were still very much virtual at the time. We did all of the virtual presentations for the various communities.
Yeah, having done some research in Wise County and places like Norton, I know a little bit about what that's.
You're very familiar.
I'm very familiar, especially since I was doing Social Security disability and Black lung related stuff. Oh. Anyway, so Pilar Bonilla, I believe you put a comment in the chat, which I think would be useful to share if you wouldn't mind. You want to say a little bit more about that?
Well, for example, right now I'm trying to get some data for a student group that I belong to, and so I entered the journal. I don't have access to this journal, and I think to download the article was like, if you're not a member, it was $500 or something, which is ridiculous as a student. And so it made me think about all this other journals that I don't have access to. And I'm a Master's of Social Work student, and I still have limited access. And if I weren't a student at all, I wouldn't have any access. And a lot of research is published in these journals. So how can you make a lot of this research more accessible to everyone? I guess that's my question.
Anybody want to respond to that one? I guess I would, if you haven't looked at it, I really would recommend go on the web and look up Chamaco, so I can provide you, if you want to email me, I can provide you with the email and or the MCHUC. But these are programs that have been going on for years. And one of the things that's different about them, some people have done the kind of work that Nakeina was talking about, which is really challenging. And I hats off to you for doing it, because there really is cultural interpretation going on there to try to get that data to those people in a usable form. And it is their data. I think we all have to agree with that, for sure. And certainly Native Americans can and have told many stories, and we've seen a lot written about things that have happened to the Native American community by having people not work with them, even when legally they should have been working with them on research in their areas. They have a Havasupai, a whole variety of other people. That's a serious issue. But I think you're raising a point there that Chamacos tried to work with all of the people involved in the community over a period of years, not just because of this project. And as a consequence, I think that's one model of, if you start a relationship in the community and the community knows this isn't a one-off, that you're going to be coming back with more information that they might want over time, especially if it can be like a forum that's there, like a library on a Saturday session or off work hours. Things like that, where people can say, hey, every now and again, we know who these folks are. So there are ways to do that. But the institutional stuff you're talking about, the money that's involved in operating these data systems have become prohibitive. You're absolutely right. Anybody have any other suggestions on how we can work around that at all? My own view is not to try to depend upon the journals to get the important academic information to the communities who as Nakeina correctly points out, it's their data to begin with. And so we've got to figure out better ways to do that. You raise a very important question, and you're right. The prices are outrageous, just outrageous. I noticed that they're about to shut down our breakout room here in just a minute. Any parting word from Aparna or Nakeina before we quit for the day?
Thank you, everyone, for being here.
Thank you. And thank you, Phil, for taking the mantle on.
Thanks, everybody, for coming. We really appreciate your being here today. Have a great conference. We'll look forward to seeing you in another session.
Thank you.